What is Huntington disease? Huntington's disease was founded by George Huntington, an MD, in the late 1800s. It was discovered that Huntington's disease occurred in a mutation of the fourth chromosome. The defective gene codes the blueprint for a protein gene called Huntington. It was named Huntington because scientists identified it as the cause for the disease. Common symptoms of Huntington's disease is uncontrolled movement, decline in thinking and reasoning, alternations in mood including anxiety, depression, hyperactivity, and learning disabilities, and obsessive-compulsive disorder. In 1993, Huntington's disease was identified as a familial disease. It was identified that an extra repeat of a chemical code in a small section of chromosome 4 is what caused the disease. The most known age for being diagnosed is 30 to 50 years old. It is also the second most common disorder, and most people live around 10 to 30 years after being diagnosed. There are 3 stages apart of Huntington's disease. The first is when subtle changes in coordination, involuntary movements occur, called chorea, which is a neurological disorder characterized by jerky involuntary movements occur, and the patient has difficulty thinking through problems. They become depressed and have an irritable mood. In the middle stage, the movement becomes worse. They may need physical therapy, and their speech starts to diminish. They have difficulty swallowing, and many times they will need help caring for themselves. In the last stage, all patients are dependent on others. They require 24/7 care, and they can no longer walk. Sometimes choking occurs, and they are able to comprehend language and be aware of family and friends, but are no longer able to talk. On average, 30,000 or 1 in every 10,000 Americans are affected by Huntington's disease. If a child has a parent with HD, they have a 50-50 chance of inheriting the gene. If a child does not receive the gene, they will not pass it on to their children. HD affects both sexes in all races and ethnic groups. Some treatment for HD. There is no determined treatment for the actual disease. However, medication can be provided for some of the symptoms like depression, anxiety, and the chorea. Though there is no cure for HD right now, research is still taking place. Most research is being done by looking at the brain and how the extra chromosome affects the brain. There are many organizations that support the research towards Huntington's disease, including Huntington's Disease Society of America, Alzheimer's Association, and the National Human Genome Research Institute. Huntington's disease needs to be solved and is a great example of what our country needs to do to make this disease go away.